Hi, I would like to tell you a story today. When I was in my first standard, I had a classmate who used to be very naughty, he used to be very talkative, he used to disturb the class a lot, he used to be on the move. The teachers were always scolding him. He always kept asking to go to the loo, and on that pretext then he would go roam around the school and not come back in the class till the school was over. So there were a lot of complaints. So many times we saw the teacher calling his parents and telling them that he is not paying attention, he is a very naughty child, and they didn't know what to do with it. They kept punishing him in the school. They would make him stand in one corner of the class because he was disturbing the class, but nothing was working. I'm talking around in the year around maybe 1976, 78. During that time there was not much known about conditions like ADHD. Today we talk about it, today we know about it, today we read about it, but that time nobody knew about it. And the final straw was when one day he bought a divider in the class. It was his siblings, and he just kept it on the desk when his partner was going to sit on it. The partner sat on it and was injured very badly. That was the last straw. That's when the principal and all got involved, and then he was punished. He was told not to come to school, and with great difficulty his parents convinced the school to let him be in the class. So now when I look back at that, he was clearly having what we call today as ADHD, attention deficit hyperactivity disorder. Now what is ADHD? Attention deficit does not mean that as a parent you are not paying attention to the child. Attention deficit is there in the child. He has problem having to focus on minor details. He gets distracted by the slightest of stimulus. That is why the parents come and say, ये एक जगह बैठता नहीं है, थोड़ा आवाज आया उसको जाके देखना पड़ता है. Okay, so it is characterized by attention deficit, hyperactivity, and third what we call is as impulsivity. Attention deficit, the person is not able to pay focus. He makes lot of careless mistakes. Even things like 2 plus 2, he knows it's 4. He knows it's 4, but he will write it as 5 and come, or he will leave it blank, and you wonder why is he doing that. Hyperactivity is characterized by when he is unable to sit in a place. He keeps running around. It is like as if there is a motor attached behind his back and he is always on the move. If he is in a small place, that small place is not able to contain his energy. That's where people label him as a very naughty child. Impulsivity is when he is not able to, example, he is not able to wait for his turn. Suppose the parent will come and tell when he has to stand in line, he will not stand in line, he has to go first. Or maybe in the class when teacher is trying to explain something, he always has something to say, because he is not able to hold back. It is impulsively he does that. So this, and the divider example that I gave you, that was also an example of impulsivity. So ADHD is an illness which needs to be treated. Many parents come and ask me, okay, what do I do to treat it naturally? I don't want to get into the therapy part of it or the medication part of it. So my answer to them is, okay, I would not advise that you try to treat it naturally. It's very simple. If you have pneumonia, are you going to try and treat it naturally? No. If you have a common cold, are you going to try and treat it naturally? Yes, you can. It's okay, because it does not have its repercussions. ADHD, it persists well into the adulthood. So it is not that as a child he had a problem and then he recovered from it on its own because you kind of gave him certain foods like badam or some other things that somebody may have recommended and he's become alright. No. What happens in ADHD? It is a known fact that 90% of people who have ADHD have these symptoms well into the adulthood. There will be phases of remission, but that they are going to be short phases. It's not that the person has become alright. So if an ADHD is not treated, what will happen? Because parents come and tell me, My parents tell, even I was like this. See, now you are all right, you are doing good. Then why are you getting into all this treatment business? So we don't want to get into the treatment part of it. We only want to know what we should do at home so that he becomes all right. It doesn't work that way. ADHD is happening because there are certain neurochemical changes that are happening in the brain, which needs to be corrected. If it is not corrected, then it's very difficult for a child to be able to perform to the best of his ability. So a child's ability may be this much, but because of his attention deficit, he is able to perform this much. And he realizes, I could have achieved this much. As he grows up, he realizes, this is my potential, but I am getting only this much. Why? It is because of his attention problem. That needs to be addressed. Many times what happens is people get confused. As a child, he was very naughty. As he grew up, when he was 12, 13, 14 years, he became all right. He was well behaved. He started sitting in the class. He was not moving around. He was not very talkative. So they feel that it is okay. Now he has improved. No, that is the hyperactivity component which has come down. But the attention deficit part of it, the impulsivity part of it may still remain, which needs to be addressed. You just cannot wish it away. So what do you do in such children? Many people say, what will happen if I don't treat this thing and I'll see what happens. So I tell the parents, several things may happen. He may continue to have an attenuated form of attention deficit into the adulthood, which will cause other problems like anxiety, depression, low self-esteem. Or sometimes it will have an externalizing kind of an repercussion whereby the person starts having some personality disorder, gets into drug abuse and gets into problem because of that. So when a person asks me, what should I do? I tell them, on one hand, you may have those street drugs which are there, and on the other hand, you have well researched molecules which have been researched properly, found to be safe and are recommended by standard textbooks for treatment. Of the two, if you have to choose, what would you choose? I would choose the medicines. No way I am going to choose the street drugs for my child. So it is up to you to decide.